Doctors of Reddit, what are the dead giveaway signs that someone is faking? If someone is unconscious, make a fist and rub your knuckles against their sternum, chest bone. Put some pressure behind it and rub quickly up and down, up towards chin, down towards belly button. It's called a sternal rub and is incredibly painful, but won't harm the person. It's very hard to completely ignore and continue with the ruse of faking being unconscious. The only more sure thing is asking your partner to hand you the eye needle to take some ocular fluid while they're passed out so they won't feel the pain of the needle in their eye. There's no ocular needle. At least not on an ambulance. We say that because not everyone knows that and they don't want to risk it. My stepmom was passed out once and totally unresponsive, so we had to call an ambulance. I don't think she was faking. But when the EMT did a sternum press, she literally came back to life like Frankenstein. She was like a egg! Exclamation mark. Exclamation mark. Exclamation mark. Exclamation mark. Then took a deep breath. It was honestly so crazy. I was 19 and have still never seen anything like it. Lol edit. Sternum rubber's name, I guess my bad. I think you can be truly passed out and come to because of pain. Not a doctor, but I once had a nurse tell me something that's stuck with me ever since. I had a gallbladder attack when I was younger, and let me tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 AM in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1 to 10 pain question. I thought for a couple seconds and told her 7 or 8. It hurts really bad. She nodded knowingly and told me got it. It hurts really bad. Most people who tell me 10 are lying. No one ever feels a 10. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. My pains are 10 as they keep texting on their phones was always my favorite. This reminds me of the time I was in waiting in the ER through the night. I don't know what everyone else was doing there, yawning, playing on their phone, munching on snacks, while I was seeing white from the pain. Slumped over in my chair, heaving saliva and bile into a plastic bag every half an hour. Didn't they have somewhere better to be at 3 AM? Exclamation mark. Question mark. Exclamation mark. Question mark. Whenever the symptoms aren't there, when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild. Y'all. WTF, please explain more. So we had to apply. Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I'll lift the arm over their face and let it go. They'll move it to prevent hitting their face or it'll likely brush their eyelashes and they'll twitch to it. That's genius. I have had a few seizures and the injuries I've had from falling and thrashing are pretty legit. It would take a hell of a lot of dedication to fake those. Not a doctor but a therapist. For some reason adolescents like faking did, formerly multiple personality disorder. It's a pretty rare and debated diagnosis in our field. I've seen people fake it by mimicking how it's portrayed in movies and on TV. Red flags are them telling you, I have multiple personality disorder and, of course, not meeting the actual diagnostic criteria. Some people feel like the common diagnoses aren't big or special enough to accurately represent their struggles, so they cosplay something worse. Whatever you're working through is a big deal to us. If you feel like you have to fake or exaggerate your symptoms for your therapist, consider finding a different therapist. I cannot stand this trend of faking it. I'm 18, so around that demographic myself, and it's especially prevalent in certain social media circles. The worst is when someone will list the names, ages, and personalities of all their alters in their bio. Guaranteed there's like a dozen of them, and right from the perspective of each of them. I mean, seriously, put some effort into faking it realistically, not to mention it's something you literally cannot self-diagnose. It is not possible. Oh dear. These kids will cringe so hard 10 years from now. I wonder where this trend started. Question mark? Was there an episode of Grey's Anatomy that featured it or something? Most often their story / description / exam doesn't make any sense. There are usually things that contradict each other. Abdominal pain is generally easy to tell when people are faking it. For example, I will press with my stethoscope instead of just listening. They don't respond to that pressure, but will when I use my hands instead. Sometimes I'll ask them if they are experiencing a symptom. That will rule out a diagnosis or make it less likely, and many times they think I'm asking it to support their supposed issue, so they will say they have it. Most of the time people aren't faking, but just blow their symptoms out of proportion. Yeah, I agree with your last sentence for sure. Are you looking for tips on how to fake things better? A couple of your other responses. Now this make me wonder. Please, for every own sake, don't do this. If someone is truly unconscious, their thumb always wiggle. Just say that out loud to yourself. Moms, I always know when you're lying because your ears turn red when you lie. Kids, cover their ears when they lie. I told my daughter that she gets a red spot on her forehead when she lies. So she started using her hand to cover her forehead when she lied. Still sometime in officially becoming a doctor, but have been taught what to watch out for. Doctor expects signs from you, not symptoms. People who Google diseases often tell symptoms that they shouldn't be aware of, refusing blood work, exaggerating your condition, description not matching their history, around public holidays / long weekends. Suspicion is always increased. Deleted. Imagine diagnosing yourself with something doctors can't easily diagnose. He should have begun with prolapsed disc. I'm not a physician but a paramedic. Honestly, I don't really care if you're faking, as long as it's halfway believable. I'm still going to treat it as the worst case scenario. Faking a seizure? You'll get a full set of vitals, a blood sugar and a shot of Benzos. There's lots of different types of seizures. If you call 911 because you're in extreme pain and want an ambulance ride, I'll put the good drugs in your vein hole. I'd rather give 100 drug seekers a 100 mcg of fentanyl than withhold it for the one person that really needs it. Can I tell if someone is faking? Yeah, most times, but it goes both ways. If you go too hard, I might assume you have a legit life-threatening injury and sedate, paralyze and intubate you, or start fourths in your jugular or shin bone. Fake it if you want, but traction may vary. Fourth on the shin. It's an IO or a traoceus, as in a needle drilled into the bone. For when someone has no easy vascular to get fourth like in an arm, or no blood pressure like a cardiac arrest to pump the vessels up to even be able to get in fourth. As a patient, it's apparently very sus if you say you don't want an oxy script. I had some shit happen. Doc started filling one out for me, and I told him not to bother since I wouldn't fill it. He got annoyed and said he wouldn't prescribe anything stronger. I got annoyed and said I didn't ask for anything stronger. For duct reasons. Oxy / hydro / codeine don't work for me. Advil literally does more for me than any of those. So I'll just take ibuprofen. But apparently the way I phrase that makes doctors think that I'm asking for better meds instead of explaining that I'm just not going to bother with the worthless ones that they default to. I burned my face with fryer oil last spring and had something similar happen. I had already been given an hydrocodone prescription from the ear doctor, and the burn center doc asked me what I was going to do for pain management. I said I already had a prescription and would probably be fine. He gave me a confused look and still wrote a oxycontin prescription. It was odd. When I broke my foot, asked about what I should do for pain, I got nothing but a hard look and some excuse. I say nothing and get 2 prescriptions. Looked for the single chip inside a deep fryer too. My wife is a doctor and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison. While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then, but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. When their allergy list is 30 medications long and their reactions to said medications are things like total body numbness or something that isn't mechanistically possible, and they come in with a painful syndrome that isn't mechanistically possible, they generally claim that their body is special and that no scientific training we get applies to them. They also claim everyone is out to get them and like to tell me stories of previous doctors they hated rather than helpful information. There are two reasons people do these things: secondary gain, requesting opiates for a high, or psychosomatic reasons. Stress causes a physical response rather than a pure mental one. The latter is real pain and not sinister in motive. Just not organic pain that is a sign of true organ injury. I'm hating trying new antidepressant/anti-anxiety meds. I'm very susceptible to sexual side effects. It takes weeks to find out if a medication has any effect at all, or if the side effects go away. I just wish I could find my California rocket fuel combo already that won't turn my clitoris off. Please click subscribe if you enjoyed this video.